Good morning. I'd like to call this roundtable to order. Today is Wednesday, January 10th, 2024. The time is 11 a.m. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today, we will consider 6 nominees to several health licensing boards under the purview of the committee, including 3 nominees from the Board of Professional Counseling, 2 from the Board of Long-Term Care Administration, and 1 for the Board of Occupational Therapy. I will describe the nominees for each board and then ask the nominees to present their testimony and answer any questions, starting with the Board of Professional Counseling. Just for folks who are watching at home, this is going to be a hybrid hearing, so we do have some of our witnesses and nominees here in person and as well as online as well. So the Board of Professional Counseling regulates the practice of professional counseling in the district, including issuing licenses, reviewing complaints, and conducting hearings. The board consists of 6 members, including 2 professional counselors, 1 educator engaged in teaching counseling, 1 professional art therapist, 1 consumer member, and 1 with at least 5 years of experience in the field of addiction counseling. PR 25-575 nominates Victoria Shirk to the Board of Professional Counseling for a reappointment as a person with at least 5 years of experience in the field of addiction counseling for a term ending July 1st, 2026. Ms. Shirk has extensive experience in addiction counseling and trauma-informed care. She has served in significant roles at various health organizations and holds a master's in counseling, marriage, and family therapy, and Ms. Shirk resides in Ward 3. PR 25-576 nominates Giovanni DeLoro to the Board of Professional Counseling for an appointment as a professional counselor for a term to end July 1st, 2024. Sorry, it's so short. So we'll see you again shortly thereafter. Ms. DeLoro specializes in trauma, depression, and anxiety. She is pursuing her PhD in counseling education and supervision and is a licensed professional counselor in Washington, D.C., as well as Virginia. Ms. DeLoro lives in Ward 1. And finally, PR 25-574 nominates Rhonda Brown to the Board of Professional Counseling for an appointment as a professional counselor for a term to end July 1st, 2025. Ms. Brown has 20 years of experience focused on adolescent mental health and substance use issues. She holds a master's in arts and community counseling and has worked extensively within the juvenile justice system. Ms. Brown lives in Ward 4. I don't see any of my colleagues here, so I'm going to call up the nominees for the Board of Professional Counseling, Ms. Shirk, Ms. DeLoro, and Ms. Brown. So for those who are in person, please come to the table. And then I'll have Ms. Shirk start, who's joining us virtually. When you're ready. Go ahead. Oh, wait, hold on. Don't go yet. I'm supposed to swear you all in. That's my fault. Okay. So before you begin, please raise your right hand so I can see it on screen. Do you swear or affirm under the penalty of law that the testimony you're about to provide to this committee and the Council of the District of Columbia is the truth, the whole truth, and nothing but the truth?
I do.
Wonderful. Okay. Now you can begin.
All right. Good morning, Chairperson Henderson and members of the Council. I am Victoria Shirk, and it is my pleasure to receive your consideration for my continued service on the Board of Professional Counselors. I'm honored to have the opportunity to serve the residents of the district. I'm a native Washingtonian and licensed professional counselor. I've operated my own private practice since 2023. Prior to that, I worked at several core service agencies in the district as a behavioral health clinician. I have worked in the professional counseling field for roughly 20 years after graduating with a master's degree from the San Francisco State University. I'm a member of the American Counseling Association and certified through the National Board of Certified Counselors. I began my first term on the Board of Professional Counseling in 2017 and became chair in 2021. The chair for the Board of Professional Counseling fulfills critical responsibilities to ensure the board can perform with a focus on quality, safety, and efficiency. As chair for the Board of Professional Counseling, I coordinate and lead our monthly meetings and ensure that all parties before the board are treated fairly and equitably. The Board of Professional Counseling works to enhance the practices of professional counseling, addiction counseling, and art therapy by developing and implementing standards and procedures that align with national best practices, reviewing applications, issuing licenses, and conducting complaint reviews and enforcement of disciplinary action when warranted. Through these efforts, the board advances equity and improves population health throughout the district. In addition to serving as chair of the Board of Professional Counseling, I am also a member of the Interprofessional Board Chair Collaboration Group, a group of 7 DC Health Licensing Boards chairs. My fellow board chairs in dentistry, medicine, pharmacy, social work, psychology, and nursing and I meet with DC Health leadership on a quarterly basis to advance DC Health's 4th strategic priority, closing the chasm between clinical medicine and public health. Together, we collaborate and learn about public health priorities and the inner workings of DC Health and serve as ambassadors and advocates for advancing population health in the district. The Board of Professional Counseling serves a central role in advancing the behavioral health workforce of the District of Columbia. Through 4 license types, the Board of Professional Counseling oversees over 2,200 dedicated behavioral health professionals. The Board of Professional Counseling and its staff work diligently to ensure both the public and its licensees are kept safe. The board also ensures that its licensed professionals keep up to date with best practices of their professions and are aware of emerging behavioral health issues through continuing education. The Board of Professional Counseling investigates and, when appropriate, takes disciplinary action to correct any complaint patients make about any of the 4 professions regulated under its authority. This can include issuing a notice of intended discipline, suspension, or revocation of a license. Staff and Board of Professional Counseling members work diligently year-round to ensure that professionals receive their licenses in a timely manner. As of May 2023, the Board of Professional Counseling oversaw the licenses of 375 graduate professional counselors, 1,604 professional counselors, 86 addiction counselor 1s, and 147 certified addiction counselor 2s. Since 2019, the number of professional counseling professionals licensed by the board has increased by 19%. This increase in the professional counseling workforce supply is needed given the increased behavioral health needs of the community. However, the Board of Professional Counseling continues to evaluate strategies to make professional counseling and addiction counselor professions more accessible to aspiring professionals from diverse backgrounds to meet this growth in demand for behavioral health services. Professional counselors and addiction counselors play a critical role in ensuring behavioral health services are available to those in crisis. In partnership with our other behavioral and physical health partners, we collaborate and work directly with people in individual and group settings to identify problems and develop solutions to challenges in their lives. Over recent years, the role of counselors and addiction counselors has become more integral to the district as board licensed professional services have been in greater demand due to the impact of the pandemic on mental health and the continued opioid crisis. As board chair, I am committed to continuing to focus on identifying new and innovative strategies to advance the counseling profession. The Board of Professional Counseling is continuing to work to expand the number of professional counselors and addiction counselors for the district's growing professional healthcare workforce needs. This includes presentations by board staff to organizations such as Catholic Charities, who train certified addiction counselors. The board plans to increase this outreach to professional counseling schools in the region next school year to both increase interest in the profession as well as to prepare students to successfully become licensed. The board is also exploring outreach to local high schools to drive more interest in these critical professions earlier in life and create pathways for our young people into meaningful careers. These efforts are an important step to strengthening and continuously improving the standards for the district's behavioral health workforce. In addition, we recently began to license professional art therapists. I look forward to continuing to work with my board staff, licensees, and our partners to advance the field of professional counseling in the district. I appreciate your time. and this opportunity to testify before the council. I look forward to any questions you may have for me at this time.
Thank you. And just hang on. Ms. DeLauro will present her testimony and then we'll ask some questions after Ms. Brown goes. Ms. DeLauro? Yep. You just push the button on the microphone in front of you. There you go.
Is it on?
Yes, it is. Go ahead.
Good morning, Chairperson Henderson and everyone in the room. I am Giovanna Di Lauro, and it's my pleasure to receive your consideration for my nomination to serve on the Board of Professional Counseling. Oh, I'm nervous. Okay. I am deeply grateful to Mayor Muriel Bowser for nominating me and honored to have this opportunity to serve the residents of our district. As an immigrant from Venezuela, I grew up in Orlando, Florida, and relocated to the District of Columbia 10 years ago to pursue a career as a professional counselor. As a green clinician working at a community health agency, Green Door, I witnessed and worked to improve the mental health disparities that disproportionately affect the underserved populations, such as the unhoused and the communities of color. I also noticed that the working class would often lack access to mental health resources by falling between being disqualified for subsidies and not having enough disposable income to afford care. In 2015, after obtaining full licensure as a licensed professional counselor, I opened my private practice, DeLauro & Associates Counseling, PLLC. Part of my mission when opening the practice was to participate in insurance panels, creating space for affordable mental health care. In addition, last year, I began to work on my PhD in counselor education and supervision. It is my hope to be part of the growth in the professional counseling field and aid new clinicians in becoming competent clinicians in our field. I am excited for the opportunity to serve on the DC Board of Professional Counseling and to pursue the mission of ensuring counselors uphold ethical, competent, and professional mental health services. It is also my hope that I can be a servant leader in the field and in my community. A considerable part of my identity as a counselor and advocacy efforts are towards dismantling white supremacy, the patriarchy, and tirelessly working towards abolishing all systems of power that oppress and isolate the vulnerable and underserved. My aspiration is to be an agent of change, not only in my personal life, but also in the counseling profession, and guide the way to building a field where its pillars are equity, inclusion, and fairness to all. Thank you, Madam Chairperson, for the opportunity to testify before this committee. I would be happy to respond to any questions at this time.
Thank you. You did great. Take a deep breath. Yeah. All right. If you just turn your mic off so that Ms. Brown can go and we not have any feedback. Ms. Brown, when you're ready.
Morning, Chairperson Henderson and your committee. I am Rhonda Pope Brown, and it is my pleasure to receive your consideration for my nomination to serve on the Board of Professional Counseling. I am grateful to Mayor Muriel E. Bowser, I knew I was going to do it, for nominating me, and honored to have this opportunity to serve the residents of our district. I'm a native Washingtonian with over 20 years of counseling experience. I'm an alumnus of Trinity College, which is now Trinity Washington University, having earned a Master of Art in Community Counseling. Currently, I'm a licensed professional counselor in the district, and I work as a forensic professional counselor for the Office of Rehabilitation and Development for the Public Defender Service for the district. I am also an adjunct professor at the Georgetown University for their Juvenile Justice Clinic, where I provide social services and mental health education and consultation services to their second and third year law students. I have extensive experience working with adolescents with mental health and substance use issues. My areas of specialty are trauma, depression, sexual abuse, loss, and adolescent behavioral issues. Believing in mental wellness and community support, I have worked to provide counseling and promoted the importance of addressing mental and behavioral issues. However, my career journey did not start directly in the counseling field. My undergraduate degree is from George Washington University, where I earned a Bachelor of Science in Radio and Television, because from childhood, I longed to know what happened behind the scenes in TV and film. I worked over 10 years in the entertainment and post-production industry. Not only did I learn about equipment and lighting, but I also quickly learned that people struggle with past and present traumas, and for whatever reason, people started sharing and trusting me with their innermost private thoughts. Here's where the spark to counsel was ignited. I decided to embark on a new journey and discovered that my dream profession was counseling. Becoming a member of this board has been my professional goals, one of my professional goals. I believe in lifelong learning, and this experience will give me an opportunity to grow and expand my thinking, but it will also allow me to invest and pour back into a profession that has shaped my purpose and provided me with chances to advocate and educate about the importance of being kind to your brain by addressing one's mental health. I will not only bring my academic and professional acumen to this board, but I will also work to create ideals and procedures to ensure that licensed professional counselors use best practices in providing the highest standard of care. I will work with other board members to thoroughly evaluate and vet applications to ensure that the most qualified candidates are licensed to provide quality care to district residents. If confirmed for this position, I will bring compassion, grace, and my passion for serving my community to this role. I do not take this opportunity for granted, and saying that I appreciate it truly just does not capture what this chance means to serve in this capacity for my city. So I will simply leave it by quoting the godfather of go-go, Chuck Brown, by saying, I can't thank you enough. So thank you, Chairperson Henderson, for the opportunity to testify before this committee. I will be happy to respond to questions from you and the members of the committee.
Thank you. And thank you to all of you for your willingness to serve. I always, when I have these board hearings, I always do a PSA for anyone out there who wants to serve their professional community. We have vacancies. And in this particular case, Ms. Shirk, you remember this because I believe you were before the committee last year, and you're the only member of the board at this particular juncture.
That is true. Not for
Oh.
long, I hope, but
Not
yes.
for long. No, you're going to have colleagues now, which is great. So I want to ask, I have a couple of questions, and then you all can sort of get on with your day. So Ms. Shirk, one of the things that I noticed from your testimony was that since 2019, there has been a 19% increase in licenses, for this particular board. Is there one area that is growing more than others? So for instance, are we seeing a lot more addiction counselors coming in? Are we seeing some growth in the graduate professional counselor realm? What's leading to this increase?
I do think there's an understanding of the increased need for behavioral health professionals. And I think it's making it a more attractive, profession. It's definitely a place where people know they will be employed, which is good because there's so much need. I don't think there's a particular field. I mean, it's a chain, right? So people start as licensed graduate professionals, and then they move on to the LPC after they've done their hours of experience. So I wouldn't say there's a particular area. I think addiction counseling has been pretty steady, particularly thanks to Catholic Charities, which is one of the primary training opportunities for people in the district.
Got it. One of the other things that you did mention was about getting more places where folks can get certified. Can you say more about that in terms of a goal for the board?
I don't know that it's about certified. I think it's about making sure that the training programs have clear understandings about the licensure pathway. Is that what you're referring to?
Yes.
Yeah. So one of the barriers that licensees run into is, confusion about the process. It's relatively complicated. You need to get a certain amount of hours with a licensed professional counselor, but then you can also get another amount of hours with a social worker. Maybe people are confused about whether they can get hours from a psychiatrist. So I think going into the training programs and clarifying that information will be really helpful in terms of streamlining and getting more people through the pipeline more quickly. Because, when people make mistakes, they submit their hours, and there's been an error in terms of their understanding of the process, it can slow them down significantly. Sometimes they increase the process by a year. And that has huge impacts, obviously, on the district's capacity in terms of providers, but obviously on their earning ability, their professional life. So we really want to
Yeah.
minimize those as much as possible.
We often get folks who will come to the committee, it's taking so long. And I'm like, I think you might have submitted something incorrectly that I can't override from the council's side. But
Appreciate it.
that's super helpful. Ms. DeLauro, thank you again for being here. I'm wondering, as an owner of a private practice, because I think Ms. Shirk also practices privately. Yes. So this would be the second sort of private practice. What unique insights do you feel like you can bring to the board?
Thank you so much for your question. I'd love to answer it. I've been in private practice since 2015, and it's been astounding to see the growth in need for mental health care. I've noticed that after COVID-19, a lot of people, telehealth was brought into the equation, and that kind of has helped create more avenues or more accessibility for people who are seeking services. I really hope that we can continue as a field to endorse teletherapy. I know a lot of people find it very helpful, and also collaborating around, will there be a possibility for a national certification or something, since there's so much remote work now, and some people kind of go out of state but want to
Mhm.
keep their therapist for a while. Is there a possibility for that? I don't know, but I'm excited to work with my colleagues and brainstorm and, try to make care as accessible to our community. Thank you.
All right, great. Are there any particular areas, I'm going to ask you this, Ms. Brown, so go ahead and start thinking. Are there any particular areas of interest that you want to see the board pursue? So for instance, for some of the other boards, they have wanted to do scope of practice changes, finding a way to streamline the application process, doing some of these other things. Ms. Shirk, being a board of one, I feel like hasn't been able to delve into some of these things. And so I'm just curious, now that we're gonna have a trio, of what does the agenda setting look like for the board and some ideas that you might have.
Thank you, Ms. Henderson. Uh, I have a couple of ideas. One, I would agree that we can streamline the application process or the licensure process. I have some clinicians that work in my practice who are provisionally licensed, or they're licensed graduate professional counselors, and they're working towards full licensure under my supervision. And it's taken them a very long time to get there, so that's something that's really important. And I do wonder how the counseling profession will be changing, just especially because of telehealth, and also how people view therapy. It's so different than maybe even 10, 15 years ago. And I
Mhm.
just do wonder if it's time for some changes. And I am curious if there's going to be an opportunity to brainstorm.
Okay.
Thank you so much.
Yeah, thank you. Ms. Brown?
Thank you, Chairperson Henderson. One of the things that's always on my mind is increasing the number of men of color in this profession and figuring out a way to make it more attractive to men of color. Coming from the field in which I work, many times I'm working with young Black men, and I'm aware of a licensed professional counselor who is a man of color. I try to see if we can team, because many times we can get young men to talk to men. And sometimes they don't want to share with me. And if I had a man here, would the answer and response be different? And they often say yes. And so to increase the number of men of color. And also, back to Ms. Shirk's point about helping people understand the hours. It just so happened that one of my professors said, hey, by the way, do you know you need this number of hours to sit for licensure? And I didn't know. All through the course of my training, I was never told.
That's
until I was
interesting.
almost walking out the door. So to make that known early on in someone's training, I think would be so much helpful and would draw people. And so I do hope we are able to get out to our local community and people in the universities and also in the high schools, because I don't think people realize that, I still don't think people realize exactly what therapy is. And so to talk about what it may look like, because people may not even realize they've already kind of been in therapy. And so to kind of help people understand more, it's something that I'm really interested in. Really understand what professional counseling is what benefits come along with it and how you can access it.
Yeah. So it's interesting. You are not the first person to say that either you got to the end of your program or you graduated from your program and didn't know what the licensure requirements were, especially since you were graduating, a program in the district.
In the district.
We've heard this come up a number of times, especially with social work. People going through the process and not knowing that they were going to have to take an exam, or, what the hours look like, the fact that you're going to have to pay for supervision. Do you have to pay for supervision in the counseling space?
Depends. It depends on if you internship or do a practicum where there is a professional counselor there on site.
Okay.
And if, like, for me, my first organization that I worked with as a counselor did not have a licensed professional counselor. So I did have to pay for supervision outside with someone that they had.
Okay.
And in my practice.
Okay. Just turn your mic on.
In my private practice, staff gets free supervision as part of their compensation package.
See, I would tell the staff that has to be part of the, compensation doesn't necessarily mean salary, because there's some other financial things that can be incentives for folks. And so, in the social work counseling space, I have some charter schools, for instance, that's part of their package. We will give you the supervision hours and you don't have to pay for it outside. I just feel like sometimes we have to start thinking outside of the box. Okay. One question I have for all of you. Were you aware that, so there's a bill before the committee now that has been submitted from the Department of Health. It's called the Health Occupation Revision Amendment. They commonly refer to it as the HORA. I didn't come up with that name. That is how it came to me. Nonetheless, this is I would call it an omnibus piece of legislation that is dealing with amendments and changes for everything under all of the professional boards, licensing boards under the Department of Health. And one of the things that it proposes is to move the Board of Marriage and Family Therapy under the Board of Professional Counseling. So essentially combining the two. Do you all have any thoughts on that? I know this is kind of putting you on the spot. I know from Ms. Shirk, I didn't think you testified at that hearing. But you've been able to marinate with this more. So I'm curious if you have any thoughts on that. And what opportunities or challenges do you think might arise from that particular change?
Yeah. I was, when I came to the district, I sought licensure as a marriage and family therapist because I received my graduate education in California, where that's the predominant counseling license. I think it makes sense because I think marriage and family therapy, the education is very similar. The work is very similar. I know that one's identity, professional identity, can feel very important. So if there was a marriage and family therapist sitting here, I imagine they may feel differently. But I think that it makes sense in terms of having an extremely similar scope of practice, extremely similar, ethical standards. I think it makes sense. I'm sure will be a staff challenge. The staff of the Board of Professional Counseling work very hard. Their workload is certainly part of the time it takes for licensure. Again, they go as fast as they can. So I do think there'll be some staffing challenges around that, and hopefully some resources will be committed to make things go more smoothly. But I think it makes a lot of sense.
Okay. Ms. Brown, Ms. DeLauro, do you have any thoughts on this?
Thank you. I would say the streamlining piece. No, more of the collaboration piece, not streamlining. More of the collaboration piece makes sense. Back to the training. The training is so similar that it would definitely make sense anyway.
They just need you to move the mic a little bit closer to you. Yep. There you go. Okay.
So bringing us under one umbrella would make sense. But that identity piece, people work hard to get the license and then become that name, that profession. And so if there was a way that they could keep that as identity.
Oh, the license name is not changing.
Okay.
It is just combining of the boards.
I think I would welcome it, quite frankly.
Okay. Ms. DeLauro?
I also agree with Ms. Shirk and Ms. Brown. I think it would be a welcomed change. Professional counseling is like the big umbrella, I think, and when marriage and family counseling, when you're in grad school, you take classes on marriage and family therapy, but the big umbrella is counseling. So I see this as a positive. And as they mentioned, I think as long as clinicians can keep that sense of identity, like I am a licensed marriage and family therapist, I don't really see a problem, aside from streamlining. Thank you very much.
Okay. This is probably the more positive. That hearing, there's a proposal to combine some other boards, and people felt very strongly about their their board. I think of this one, I think the committee felt like it made sense to sort of streamline, but we'll work through that process. But while you guys were here, as it also will impact you, I thought that we should ask. Yes, Ms. Delora.
I want to say we're counselors, so I feel like, we're very understanding and kind of trying to see the big picture of things.
It's good, but sometimes y'all have disagreements on things. That's super important. Ms. Brown, I just want to ask a follow-up question. So first off, I think your background is so fascinating, how you went from like film and career in television and was like, oh no, but people are telling me all their hearts and desires and dreams. And so let me make a career shift, which I think is like super brave of you to have done that. But also now your role as a forensic professional counselor, what does that entail? And how has it influenced your understanding of the intersection between mental health and the judicial system?
Thank you. What does that entail? No day is the same. So I work with attorneys who work with juveniles who come through the juvenile justice system, and work with my clients to figure out the why. How did we get here? And then to attempt to coordinate and identify services to move them out of the system, to try to help identify pro-social activities, to try to look at school, to try to look at family, to figure out how we got here and how not to come back here. And so I work with many of the agencies in the district when I do have a client to try to align them with the best fit, to give them a lot of support, and then work with the families, because court, as you may know, just like this council, can be stressful. And so try to educate people about some of what their brain may be doing through the experience. So we talk a lot about adolescent brain development and talk a lot about why the brain is doing what it's doing at this time, and then work with people to help understand what trauma does and how trauma impacts a lot of how people are navigating. And so I work to educate, promote awareness about services, and then do some advocacy work to try to bring more services to the district. And so that's part of, again, why this was such a goal of mine, because I do hope we have opportunities to work with other agencies like DBH to kind of funnel to them what more could be helpful to the residents in the district, because there still is a great need to provide mental health care, and there's some gaps that we're still seeing. So that's kind of the work that I do and how it kind of will mesh into this role.
That's great. I honestly didn't know that PDS had that role. And so I actually think it is, I think more hopeful and inspiring around trying to break some of the cycles.
We're one of the first PD offices to have this type of role, have a
Okay.
social work division as a part of the agency. And so other PD models are attempting to replicate what we're doing.
That's great. That's great. Okay. My final question, has DC Health explained the time commitment required for this board, and do you believe you have the capacity to serve? Ms. Shirk, I'll start with you. You know what the time capacity is.
I do. And yes.
Yes. Okay.
Yeah.
Ms.
Thank you.
Delora.
I've been on the application process since 2020. So I am definitely committed to whatever time commitment will be required of me.
Okay. I'm going to save my comment on that, but also just to say, I hope that MOTA goes ahead to process your paperwork for a reappointment, considering that your term is to expire in 6 months. All right. Ms. Brown?
Yes.
Okay, great. All right. Well, I want to thank all of you for being here today, for your testimony. I think we have copies of all of your written testimony. I think we have all the paperwork that we need from all of you. So we're going to go on to the next board, but you are excused. So thank you so much.
Thank
Thank
very
you.
much.
Okay, so we will now consider the nominations for the Board of Long-Term Care Administration, which regulates the practice of nursing home administration, the practice of assisted living administration, and the practice of home health care administration in the District of Columbia. The board is comprised of 7 members, including 2 nursing home administrators licensed in the district, 1 assisted living administrator licensed in the district, 1 educator from an institution of higher learning engaged in teaching healthcare administration, 1 allied health professional in the district who has demonstrated interest in long-term care, 1 health professional licensed in the district who has experienced long-term care, and 1 consumer member. That is a lot. There are 7. Okay, so PR 25-560 nominates Dr. Baritha Harris as an allied health professional on the Board of Long-Term Care Administration. Oh, hold on one second. Apologies. Dr. B. Michelle Harris. As an allied health professional on the Board of Long-Term Care Administration, Dr. Harris is currently a member of the board and teaches nutrition course as an associate professor at the University of the District of Columbia. She is also a licensed dietitian and health correspondent for the East of the River newspaper. Dr. Harris received her BA in chemistry from the College of Holy Cross, her MS in nutrition from Framingham State College, and her MPH from Harvard University, and her PhD. Ooh, she got a lot of paperwork. Her PhD from the University of Maryland, and she was a Ward 4 resident. PR 25-56 nominates Judy Brinkenhoff as a health professional with long-term care experience. With experience in long-term care to the Board of Long-Term Care Administration. Judy Brinkerhoff is a registered nurse in the District of Columbia. She has served as a DC school nurse for more than 20 years and received her Bachelor in Science from Skidmore College and her Master's of Science in Nursing from the University of Texas, San Antonio. During her time as a nurse for the United States Navy Nurse Corps, she cared for hundreds of chronically and terminally ill patients who required long-term care, palliative care, and hospice. She is a Ward 3 resident. All right, so ask if you join us at the table. And before anyone begins, I need to swear you all in. Although I think, Judy, you already did it, but just in case. So if you could raise your right hand, do you swear or affirm under penalty of law that the testimony you're about to provide to the Council of the District of Columbia in this committee is the truth, the whole truth, and nothing but the truth?
I do.
Great. All right, Dr. Harris, if you want to go first. So you just need to hit the button in front of you and proceed when you're ready.
Good day, Chairperson Henderson. I am Dr. B. Michelle Harris. It is my pleasure to receive your consideration for my nomination to serve on the Board of Long-Term Care Administration. I am appreciative of Mayor Muriel E. Bowser for nominating me for the position of Chairperson of the Board of Long-Term Care Administration. I'm honored to have this opportunity to serve the residents of the District of Columbia and those who work in long-term care facilities. I have served as a member of the Board of Long-Term Care Administration since my initial appointment on July 25th, 2017, as a DC licensed allied health professional for this board. My license is as a dietitian in the District of Columbia. I have served as interim chairperson of the board since approximately October 2023. I am the successor to Ms. Keisha Dale, who was outstanding and passionate chairperson who led this board before me. I appreciate Ms. Dale's strong leadership. I learned much from her management of this board during the 5 years that we served together. Ms. Dale and the staff of the Long-Term Care Administration provided me with the foundation I need to serve as chairperson for the Board of Long-Term Care Administration. And I just want to emphasize that the staff are really great. I mean, they've been there through different stages of everything. So without them, I don't believe any of the boards of health could be successful. I am a native Washingtonian, a product of DC Public Schools. I left the District of Columbia for several years to pursue higher education. I also served as a Peace Corps volunteer in Guatemala, Central America for 2 years. My professional career after college has focused on working to empower individuals and communities. Healthcare and education are the main vehicles through which I work to realize my goal of equipping others to do their best to take care of themselves and their loved ones. My professional background is in nutrition and dietetics, public health, and higher education. I'm Associate Professor of Nutrition at the University of the District of Columbia, where one of my courses is geriatric nutrition, even though everyone in long-term care is not older and older adult. But anyway, I have experience in working with healthcare providers in various fields. I am excited to continue to serve on the Board of Long-Term Care Administration for as long as I am needed and for as long as statutes allow me to serve. Moving forward, I will work to advocate for non-DC residents to serve on various boards of the Department of Health. It is understandable that there are many committed healthcare providers licensed in the District of Columbia who are committed to serving our residents. However, many of them may not live in the District of Columbia, which at this moment is a requirement. Expanding the pool of candidates for various positions on the Board of Long-Term Care Administration will help us to better serve the residents and the licensed health professionals of the District of Columbia. I will work to invite others to serve on the Board of Long-Term Care Administration and even outside of this board on other health boards and commissions of the District of Columbia. I envision that the Board of Long-Term Care Administration will have every seat filled. That's one thing I really want to happen. And if all seats are filled, we can form different committees as needed to address challenges as they arise. I will actively participate in any future reimaginings of the Board of Long-Term Care Administration. I will let colleagues and others know of myriad opportunities to serve the residents and the licensed health professionals of the District of Columbia. And I thank you, Chairperson Henderson, for this opportunity to testify before you. I will be happy to respond to any questions from you. Thank you.
Thank you, Dr. Harris. Ms. Brinkenhoff? Oh, you're on mute.
Good morning,
Good morning.
Henderson and members of the committee. I am Judith Costello Brinkerhoff, Captain, Nurse Corps, Navy, retired. It is a pleasure to receive your consideration for my nomination on the Board of Long-Term Care Administration. I'm grateful to the Mayor Muriel Bowser, for nominating me, and honored to have the opportunity to serve the residents of our district. I'm a native of Darien, Connecticut, graduate of Scribner College with a Bachelor's of Science in Nursing, and the University of Texas with a Master's of Science in Nursing. My family and I have lived in the district since 1994. My husband is a retired attorney with the federal government, and our two daughters attended district schools from nursery through high school. I think an essential component to my testimony is that both my mother and father-in-law were longtime residents of 3 nursing homes, 2 in the district. As both a registered nurse and their primary advocate, I had regular opportunities to observe what happens at the bedside. My successful career as both a Navy nurse and experienced school nurse enhanced my ability to accurately assess issues. My role as a family member was also critical. Regarding my background, my most recent school nurse role was at Beauvoir, the National Cathedral Elementary School. For the past 25 years, I have served in several school nurse pioneer opportunities. I was the first school nurse at both the Kingsbury Day School and the Lab School of Washington. During the pandemic, I volunteered as the first nurse consultant at the Washington School for Girls. I presently volunteer at St. Columba's Nursery School as an immunization consultant. I have a full and unrestricted license to practice nursing in the district. I've been a longtime member of the District of Columbia School Nurse Association, and I've affiliated with the private, parochial, and independent school nurse group for more than 15 years. I've been a regular member of the DC Immunization Coalition, also known as DC, since 2016. Both my military and school nurse career tracks are relevant to the responsibilities of this board. The professional experience acquired as a school nurse in the district, especially during the pandemic, may not seem immediately related to long-term care, but I promise that my diverse skills enhance the ability to assess issues in long-term care for the patient, the staff, facility, and the family. Similar to long-term care residents, children in schools become ill from communicable diseases. It was essential during the pandemic and during my time in school nursing to establish outreach and communication with our colleagues at the Department of Health. Their guidance was incredibly helpful. Health promotion and communicable disease prevention efforts in school are priority. Nurses, whether in school or in a hospital or in long-term care, must clearly communicate with staff and families in an effort to reduce disease transmission, promote vaccine compliance, and prevent injury. Both students and residents require adequate sleep, nutrition, and activity. Sometimes student activities are limited and accommodations are required. Emergency drills and methods to transport and evacuate must be in place in school as well as in long-term care. The hazards of immobility are not unique to long-term care residents. Young students often require a change of clothes or present with symptoms of gastrointestinal upset. Students become bored, lonely, and experience sudden onset stomachache or headache when family dynamics change. Long-term care residents, especially if hearing or sight impaired or without family, equally ask for a compassionate ear. Nurses in school must manage chronic disease such as asthma and diabetes and quickly assess a lash or a laceration. Children in schools experience emergencies such as falls, fractures, seizures, and anaphylaxis. Abuse can occur in any patient care setting. Students misplace hearing aids, glasses, and insulin monitors. They require defibrillation, medication, and they require hospital transport via ambulance. Their health and wellness is covered by the district policies related to annual medical and dental exams, required immunizations, and the DC Nurse Practice Act. Regular and positive communication between the school nurse and the family is key to successful outcome, no matter the practice setting. These clinical practice scenarios and guidelines are not unique to long-term care. Prior to school nursing, I spent more than 2 decades on active duty in the Navy. 2 assignments that prepare me for this board was the experience I gained as a nurse executive with both the Office of the Navy Inspector General and the Office of Health Affairs at the Department of Defense and the Pentagon. During these tours, I wrote healthcare policy and procedure for military medical and dental facilities worldwide, oversaw quality of care efforts, staff orientation and training, issues related to licensure, accreditation, risk management, adverse action, access to care, abuse, and safety. Foremost, I learned to collaborate with all members of the multidisciplinary team and my Army, Air Force, Marine, and public health partners. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I would be happy to answer questions from you and members of the committee.
Thank you. Thank you, Dr. Harris and Ms. Brinkenhoff for your testimony and again for your willingness to serve. Dr. Harris, you've been serving as the interim chair of this board for a few months now, and I'm curious as you look forward into the next year and the year beyond that, what do you think are some of the top issues facing long-term care that the board will need to address? You just got to turn your mic on. There you go.
One of the issues that repeats itself is to having an exam that tests the jurisprudence for what happens in DC, you know, in terms of ethics and everything that can be standard for us. Because coming from other places, people who move into DC may not be familiar with it. And we have to make sure that it's something that's put there, but we need more people on our board to really address that in detail and, you know, and that's one thing. And another thing is to get the word out. And I hope this hearing will encourage folks who are maybe viewers to let folks know that we welcome them in to help with, you know, we don't have a problem with speeding things up because the numbers of licensed long-term care administrators in DC is not large, but we do we do need more people in to get to a lot of the details of what is happening inside. And Ms. Brickenhoff alluded to certain things. She may have more experience, more recent, of having loved ones in long-term care facilities in
Mhm.
DC.
I think one of the things you brought up though was around workforce. In your time since you've been on the board since 2017, have you seen an increase in the number of licensure applications, or has it been fairly steady, or has it dropped?
It hasn't dropped. It's about, it's about the same. It's steady.
Okay.
But usually if a person applies for a license in DC, because we focus a lot on getting folks licensed, they may spend, they have to do they have to get training in a facility,
Mhm.
do a lot of different rotations. And we in DC have really generous souls who serve as mentors for those who come in. So we don't have a big problem with that. And we encourage those who complete it when they're qualified or have enough time under their belt here to also give back. So we don't have a real problem, as was mentioned in another, the other hearing for others, about folks having to pay for getting through.
Yeah.
Because we have a lot of generous souls who support those who are coming along. But I've been there for about 5 or 6 years, and it's about the steady number. One unique thing about what we do is that we have folks come in, applicants come in along with their mentor, and we get to meet them and we get to understand their spirit and give them a lot of support, because 6 months or so is a lot of time to give, for training in an area.
Yeah.
And so I really appreciate that, and I hope that stays, that we get to see them, whether it's virtually or in person, so that we can get to ask them about their experiences when they're in training, and also those who are preceptors to let us know what we can do to facilitate the process.
Okay.
But I'm not sure if I answered your question.
You did. I mean, I think one of the things I asked around was like, what are some of the things that you want the board to focus on going forward? So let me ask it sort of a little bit, or ask a secondary question. How do you see the board's role to engage with and attract young healthcare professionals to decide to enter into the long-term care fields, right? I think that we have particularly in DC, we have a growing senior population, many of whom they want to age in place, which I think is fantastic. But not everyone has the ability to be able to do that without assistance and do that 100% independently. But in order for this to work, we need younger folks to go into this profession. And I'm curious where you feel like the board's role is in that.
I think our board can participate in some of the career fairs. They have the district-wide career fairs, and advocate for making sure people know that it exists. Because in my field too, which is dietetics, nutrition, a lot of folks don't know early on that it exists, that it's an exciting career. If they have passion for helping people, they just don't know. And I was that way too. I didn't know until I graduated undergrad school that there was a field. So I can say that in the last few years, I have seen quite a few young folks who, people under 25 even, who are coming in to get licensed as long-term care administrators. But I believe that our board, if we are engaged through citywide kinds of efforts, that folks are coming in anyway, and plus going to middle schools, high schools, if we don't do it directly to encourage folks in the field already to do that, to facilitate their going, but we'll need support, because if we're, and many of us also.
And
are
you have
working
other
too.
jobs and things like
Yes.
that. You know what I actually think? So one of the things that will likely be included in the HORA is to lower the age for certified nurse assistants for CNAs to 16. And I know we have at least one LEA who wants to do a program specifically on CNAs, so that folks are graduating with your diploma and your certification at the same time.
That sounds exciting too, because then even if they start off with an entry level kinds of a
Yeah.
certification or degree, they will get to, we still need to talk to them too, so they know this is an option. And everyone doesn't have to be an older person, like over 30, 40 or so forth,
Correct.
to come into this field. And these are kinds of discussions I really love, because if we're isolated and just think linearly, we won't get what I just heard from you, other ideas to spark continued discussion and ideas popping up.
Yeah, Ms. Brinkenhoff, I want to bring you in on this conversation. What do you see as the role as sort of engaging more professionals to enter into the long-term care profession and field? I think for you, you kind of whine to it, but you are a nurse for a very long time. Nurses can work in lots of different arenas. Oh, you muted yourself.
And that is correct. And nursing homes traditionally have not been the go-to place for a new graduate. So nursing homes or long-term care needs to be a recognized specialty, and the leadership needs to have sparkle and needs to be innovative and needs to be collegial and needs to be out there and know what's going on with their staff and know the training and the background of their staff, and are the staff getting to the bedside? Are they making a positive change for the patient and the family? Are they doing the best that they can?
Yeah, no, I understand. And I also want to thank you for your service in the Navy. I'm a Army brat myself. And the district is home to over 30,000 veterans. So I think you bring a very interesting perspective to the table, particularly in this work. And I was very interested in your background that, you had oversight over the Navy Bureau of Medicine and Surgery, and that you were the head of staff for the military medical treatment facilities worldwide. How do you plan to use that background to inform a little bit of the work that you'll do on the board?
Sure. Just to clarify, I was a Navy Nurse Corps officer, and I was selected to be on the team of the Office of the Navy Inspector General. And it was a team led by the Navy Inspector General. The mission was to be the eyes and the ears of the Navy and to review medical and dental facilities. And then from the Navy IG, I went to the Department of Health Affairs, which was the Department of Defense, with all three services, Army, Air Force, and Navy, and reviewed healthcare policies for the Defense Department. And so I was introduced at a very young age to rules, policies, accreditation principles, things like adverse actions, that abuse, safety, risk, malpractice. Eyes and ears of the Navy means you basically learn to walk into a facility and scope out where the breaches are, scope out the vulnerabilities, scope out the high-risk situations, infection control practices. Are they meeting accreditation standards? So I think that background is very important to walking into or evaluating any healthcare opportunities that we're providing to our residents of the district.
Great, thank you. So as what came up with the previous panel is a similar situation. So this question is for both of you. Under the HORA, DC Health is currently proposing to remove this board and merge it with other professions under the Board of Nursing. Are you aware of this proposal, and does that impact your interest in serving on this board? I don't know if you have a particular position about that change. Dr. Harris?
Yes, I'm aware of that, that change. And
Proposal.
I'm aware of that proposed change.
Yeah.
And I actually welcome it, because it involves interdisciplinary kinds of things, because the folks who come through us for licenses, they have backgrounds in nursing, social work, different kind, other fields too. So it won't be new to many of them anyhow to not have a specific board just for that. And it doesn't impact my interest in serving for and when gave my testimony, I mentioned that too. No matter how it's reimagined or how this is reimagined, I support it.
Okay, Ms. Birkenhoff?
I would step carefully. In my experience in nursing homes, yes, nursing is a component. The healthcare administrator is significant. The allied healthcare providers, the physical therapists, the occupational therapists, certainly the social workers, those roles are essential and need to be coordinated. And I'm not sure nursing is a component, a vital component, but doesn't oversee the other specialties. And it's critical, for example, during a patient care conference for the family to have representation from the disciplines that the client is receiving, not just nursing, but social work, pastoral care, palliative care, the physicians. They need to have, someone needs to be working for them to find a primary care provider, get them to their eye doctor, get them to their cardiologist, arrange for transportation. Again, those things are more than nursing. It's a group effort. So I could see some concern.
Yes. There were people who testified on both ends of the spectrum when we had the hearing on this. Dr. Harris?
My understanding would be that there will be persons who are long-term care administrators on that, they will have to, I believe they should have.
Yes, the proposal would not strike long-term care representation. It would
Mhm.
add additional seats to the Board of Nursing. But as with some other things, I'm not sure how long your long-term care meetings are now. But then you will be going to sit through the Board of Nursing meetings, which are significantly longer.
And unfortunately, they may lose that component of having long-term care administrator candidates to come in. That is really, that was something that I really loved.
Mhm.
And I'm not sure if they do have a large number of folks to come. Maybe they have to meet more frequently or something
Yeah.
and have focused on, like not have everyone.
Oh, for specific meetings, focus on specific professions.
Absolutely, yes.
Yeah. So speaking of time and meetings, have you both been informed of the time commitment required to serve on this board, and do you feel like you have the capacity to do so?
I have served for several years, so I understand the length of time that I commit, not only in the board
the-
meeting itself, but
but-
outside work too.
Yes, the pre-work and
Yeah.
and post-work. Ms. Birkenhoff?
I'm an open book. I'm learning from the testimony about some of the requirements, but I'm willing, I volunteer, I'm eager.
Wonderful. Dr. Harris, how many, I don't have the list in front of me. I'm sure I can find it somewhere, but how many vacancies are currently on the board? Oh, you don't have your mic on. There
As
you go.
you mentioned several seats.
Yep,
We have 2 seats now, and I want to say this now. Mrs. Captain Nurse Brickenhoff and
Brinkerhoff.
I are the 2 now. And so we have all the other seats are open, and I encourage anyone that is a viewer to get word out that we encourage others to join us too. If they're not at the point that they can or will or are qualified to do it, spread the word. It's really important, especially those who know folks or have had known folks in long-term care, to let them get the best they can.
Yes, so you're joining me in my PSA. So we have 5 vacant seats. I think we need some assisted living administrator. We need 2 nursing home administrators. We need some other folks on that front. But I don't have any further questions for you all right now, and I don't see any of my colleagues who have joined. So I want to thank you so much for your willingness to serve. I think we have all of the paperwork from both of you. So we appreciate you, and you're excused.
And thank you. And I appreciate you.
Thank you. Thank you. All right, so we're gonna go on to our last nominee. And I'm gonna apologize up front because I should have asked you how to pronounce your name, and I didn't before we started this hearing. I could take an educated guess, but I'm gonna turn my mic off and then you're gonna tell me and then I will say it correctly.
Oh, wait, turn it off.
Okay, all right. So we now have our nominee for the Board of Occupational Therapy. The Board of Occupational Therapy regulates occupational therapists and occupational therapist assistants in the District of Columbia. The board is comprised of 5 members, including 3 licensed OTs, 1 occupational therapist assistant, and 1 consumer member. PR 25-578 nominates Olumolu Majikatomi, yes, to the Board of Occupational Therapy for an appointment as an occupational therapist for a term to end April 16th, 2024. Again, to Moda. Go ahead and start the paperwork again. He is the CEO of Triumph Therapeutics and the vice president of the DC Occupational Therapists Association. Previously, he served in DC as occupational therapist at Functional Pathways from 2016 to 2018 and a pediatric occupational therapist from 2013 to 2016. He has a master's of science in occupational therapy from Howard University and lives in Ward 5. All right, so before you begin, we're just going to swear you in. So if you raise your right hand, do you swear or affirm under penalty of law that the testimony you're about to provide to the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth? Great. All right. If you just turn your mic on and you can go ahead and present your.
Good morning, Chairperson Henderson. Well, good afternoon now. Good afternoon, Chairperson Henderson, members of the committee and staff. I extend my heartfelt gratitude to members of the DC Board of Occupational Therapy and to Mayor Bowser for nominating me to join this esteemed board. It's a privilege to be here today. My name is Omololu Majikatomi, and I have the honor of serving as a pediatric occupational therapist in the district. My journey in this field spans over a decade and is deeply rooted in serving the district's children and families. My path to occupational therapy began at Howard University, where I obtained my Master's of Science in Occupational Therapy. My commitment to the district, its residents, and the field of occupational therapy runs deep. My mission has always been to enhance the quality of care and accessibility of OT services within the district. I take pride in my ability to stand in the gap and provide quality services to families confronting numerous social determinants of health, which typically hinder their access to care. My story is one shared by many in the district. I'm an immigrant. I grew up in a Nigerian household where the values of academic excellence and entrepreneurship were pivotal. These values shaped my aspirations to become a leader in my field, always striving to provide exceptional care to my clients. In December 2013, I founded Triumph Therapeutics, a culmination of my dedication and dreams. Since its inception, we have been able to be a source of support for over 1,500 clients. Our focus has always been to serve those in the community who need our services the most, particularly through our commitment to the DC Medicaid managed care organizations. We actively participate in the community. We sponsor various events and initiatives. We support our local public schools. We support early learning programs, and we connect local healthcare providers who share our same commitment and enthusiasm to the district. Beyond my clinical work, I'm passionate about supporting occupational therapy students from local universities, including, but not limited to, Howard, George Washington, and Trinity University. My success today is a testament to the outstanding therapists who came before me, and it's crucial for me to pay it forward by nurturing a compassionate learning environment for the next generation of occupational therapists. When the invitation for therapists to apply for the board position came, a thought struck to me. This is the moment. Over the years, I've poured my heart into nurturing Triumph, fostering a culture of support, care, and excellence. Now I feel it's time to extend my impact beyond the walls of Triumph and use my entrepreneurial journey and experiences as a minority in this field to influence and shape the future of OT in the district. My role as CEO at Triumph has not only deepened my love for occupational therapy, but has also highlighted the importance of advocating for our profession and inspiring future therapists about the possibilities and rewards of a career in occupational therapy. Representation is crucial in any field, and in occupational therapy is no different. I stand as a minority male therapist in a profession largely represented by those who may not share similar life experiences. My goal is to be an encouraging figure for all students aspiring to join the field, with a particular focus on men of color to consider a career in occupational therapy. In my daily work, I have the opportunity to see firsthand the impact that working with therapists from diverse backgrounds has on children. Specifically, as a Black man, I understand some of the unique needs and challenges faced by my clients due to my lived experiences. By having a diverse representation of practitioners, the profession becomes better equipped to provide culturally competent and sensitive care to a wide range of clients. Clients often find comfort and understanding when they see a healthcare professional who shares similar backgrounds, as it establishes a sense of connection and trust. My candidacy for this board position is backed by my experience in creating diverse job opportunities, not just for occupational therapists, but also for speech language pathologists, physical therapists, and administrative staff. My approach, which blends innovation, creative problem solving, and a forward-thinking mindset, positions me well to contribute significantly to the advancement of this board and to the OT field as a whole. Should my nomination to this board be confirmed, I'm eager to lead efforts that enhance the visibility and importance of OT in state and national legislation. As Vice President of the DC Board of Occupational Therapy Association, I was honored to utilize my experience in the field to serve as the most recent conference chair. During our 2023 conference, I was able to lead impactful conversations about growth of the field, current best practices, the need for lobbying, and more. As a confirmed member of the DC Board of OT, I would be elated to not only continue these conversations, but to move forward with taking the necessary action steps to substantiate and propel the field. My primary objective is to underscore the essential role of OT across all healthcare sectors. Currently, many allied health professions, including ours, are grappling with significant funding cuts, posing challenges to attracting and nurturing talented and innovative professionals in the field of OT. It's imperative that we propel our profession into the future. I wish to extend my gratitude to this board for its ongoing efforts, to the Board of Occupational Therapy, to its ongoing effort to support the OT Compact, thereby facilitating increased access to services across borders of the district, Maryland, and Virginia. My vision for the Board of OT is to firmly establish OT as a critical, influential voice in healthcare discussions. I see OTs working collaboratively with physicians, nurses, mental health practitioners that came before me, not just as participants, but as change agents in healthcare. By doing so, we can ensure our profession is not only recognized for its value, but is also instrumental in shaping the future of healthcare delivery. Thank you for your consideration, and I welcome any questions you may have.
Thank you so much for the work and the interests the work that you do as an OT, but also your interest to serve on this board. My daughter has an OT we've had for 2 years, and it is phenomenal the work that can happen, like the change that can happen with the work that you do, which is very specialized. Like, people don't think about even down from like how you hold a pencil and like helping to improve pen, all of these different things. So you talked a little bit in terms of like how your experience has prepared you for the challenges and responsibilities of the board. I'm curious, as VP of the DC Occupational Therapy Association, have you had to interact with the board in the past from that capacity?
In some ways, the DC Board of OT Association has been meeting together to push our support for the compact, for example.
Okay.
And so we are on the ground speaking with therapists who are working, speaking with therapists who might live in Virginia, but they drive 20 miles or to Maryland, but then they can't see clients just 2 miles down the road because there's no license or compact. So I work with the board in that aspect.
Okay.
But other than that, no, not much.
Okay. Well, that you answered a different question I had around like what was your stance on the compact, because that piece of legislation is currently before the committee, but I would assume that you're in favor of it. Okay. In terms of what you would like to see happen with the board, focusing on whether particular areas or changes in the future, are there any things that come to mind?
I think I'd love to see the board focus on creating a way to tell younger children, especially kids in the district, what OT is.
Mhm.
and especially focusing on young African Americans, men to come into the field. I think a lot of times the families that we serve at Triumph, they just have no idea what OT is, how we can help their children. And OT is kind of like that forgotten field that no one really talks about. So, I have parents who just come to me and say, this kid is just bad, or he's just a problem kid. He doesn't want to, he may have some sensory processing aversions, and he doesn't want to wear this particular thing, and he's just bad. And it causes so much trauma, and the kid is crying, the dad is yelling, mom doesn't know what to do, she's pulling her hair out. And when they come to us and they, they say, hey, we can help, this is what we do, this is how we can help, this is the change we can make. They're just like, they're blown away. So I think if we educate, especially high schoolers more, as a board, and have a concerted effort to focus even before college, I think that'd be really great. That'd be great for the profession.
Yeah, I think exposure is super, super important. And one of the things I learned from the dean of the School of Medicine at Howard was just like, the exposure can't actually just be when you're a senior in high school. Because by that point, what you have done in the 3 years prior, from the coursework, from your grades, impacts what happens next. And so how we do exposure, earlier on. But even in that, do you have any thoughts around how, so I would imagine teachers in the K-12 space are familiar with OTs because they work in school. Oh, no, not, okay. I'm making an assumption. But I'm curious around whether or not this should be something that's more discussed in the early childhood education field. So like childcare workers and folks who work in ECE, because in some cases, some behaviors are presented in those settings. And with early intervention, you might not need it in 5th grade or 6th grade. Your thoughts on your thoughts around how the board can better engage with beyond just the K-12 space, but ECE community?
To comment on, teachers knowing what OT, Triumph, we actively go out to the community and we provide presentations to teachers. I recently did a presentation at the National Presbyterian School of how OT can support teachers. And NPS is extremely well-resourced school. And, there were a lot of things that they didn't know that OTs could help with, and OTs and teachers do work hand in hand together. And I think in public schools, OT is mandatory to have, but in some schools it's not mandatory, so I think educating more people will benefit everyone as a whole. And early intervention is extremely important. I think going to, for example, we did a presentation at one of the Apple Tree schools, which happens to be one of our neighbors.
Okay.
And they specialize in that pre-K.
Mm-hmm.
And being able to provide, tangible hands-on advice like seating equipment, how to identify, if a child should be having their proper pencil grasp, but they're not, maybe we can talk to an OT earlier so that this isn't something that kind of just swept under the rug. And, so many people just assume that, oh, they'll just learn it later, but these are actually red flags for something bigger. Maybe the OT can identify this if the teacher tells them, and then we can speak with the physician and we can start that identification of, autism spectrum disorders, sensory processing disorders, so many things a lot sooner. And I completely agree. I think the board can and should be more instrumental in the ECE space to promote what we do.
Right. So DC Health in the HORA, I put all of our boards today. You have HORA issues. The bill that's currently before the council, they propose to merge the Board of Occupational Therapy with the Board of Physical Therapy and Audiology to become a new board, the Board of Rehabilitative Therapies. Do you have a thought about this merger? Does this change your interest in wanting to serve? Just your thoughts.
It doesn't change my interest in wanting to serve.
Okay.
First, I would have to take a look at, there are many different requirements for each profession.
Yeah.
And so first, how would we all come together and make something streamlined or standardized for everyone? just speaking from OT perspective, we're very, qualitative individuals. We do, so some of the coursework that the physical therapists take, OTs don't have to take. Some of the coursework that speech therapists take, OTs don't have to take. Some things we do have to take together. So I just first I just need to see how do we streamline all those things. Like, I don't think I have an answer today.
Yeah.
But it's it's a
We're
big-
not voting on the bill
Yeah.
this month.
it's a big
Yeah.
ask, yeah.
No, this helps us in sort of trying to detangle some of what could be the benefit, what could be a challenge.
Mhm.
During the hearing, we had, so for instance, a lot of people in the physical therapy space who were like, nope, no, thank you. We need to stay separate. And then there were others who were like, well, there are some overlaps, but we would need to figure out some of the things that you talked about. Like, I think, unlike the Board of Professional Counseling, where there's some subspecialty fields, but everybody's basically taking the same coursework, that might be a simpler thing than what you said around OT and physical therapy and audiology. There might not be any classes that you all take together. Or even with the hours, like, right? I think you guys, do you have, for licensure requires a certain amount of supervision hours?
We have to do field work.
Field work,
Yeah,
right, yeah.
so, I mean, each discipline has its own field work requirement.
Yeah.
As a business owner, I know because I see the students come through. But like, for example, I'm gonna speak on OT because I'm biased. I don't think physical therapy and audiology have the mental health training that occupational therapists get, and that make us a unique, distinct discipline, so I would have to sit and look at the bill and look at the reasoning, the why.
Okay.
I'd like to look at their proposed how and to see if it makes sense for all the parties involved.
Okay. Well, let me ask you this. In your role as VP of the DC Occupational Therapy Association, it would be really great to have feedback from the association about this particular point, and how you all feel about that, because I don't think the association testified about the merging of the boards. So that would just be helpful. I know I'm giving you homework for your side.
I will confer with the OT Association and get back to you.
Great, thank you. Okay. But otherwise, as we're sort of moving forward, you've been informed about the time commitment of the board and you're feeling good?
I have.
Okay, great. And again, to Moda, this term ends on April 16th, 2024. So we would love to see a reappointment documentation. We won't make you come testify again because you've already testified in the same year. But we'll just move through that. But I don't have any other questions. Is there anything that you wanted to say that I hadn't asked you today?
Just thank you for your time.
All right. Thank you so much again for your willingness to serve. And I want to thank all of our witnesses and nominees today. If anyone wanted to testify in favor or support or not of any of the nominees, but didn't do so today, you still have time to submit written testimony online. If you just go to the DC Council website and click on the hearings tab. And for this particular hearing, you could just upload your testimony right there. But this concludes today's roundtable. The committee does plan to meet again on Tuesday, January 16th. So if you have some alternative feedback about these nominees, gotta get it in quickly, because we're going to vote on these nominees on Tuesday, January 16th. On January 18th, so that's next Thursday, the Committee on Health will kick off its 2023 performance oversight hearings, and we will hear public witness testimony for DC Health. But the time is now 12:22, and this roundtable is adjourned. Thank you, everyone.